Myself, Dr. Jasul, course coordinator from Ayurveda Map. So, welcome all to you to the today's session. The Swadhyaya, it is the academic sessions from the Ayurveda Map. So, we are giving support to the BMS final year students and the PG first year students now. And Tuesday is allotted to the Kaichilsa. We are planning 25 classes in every subjects, and it will be weekly classes. And the our approach is an exam point of view approach we have, and we discuss question papers, research topics, etc. So you can register with this. This is the free class. We have Dr. Susmita, ma'am. She is an academician as well as a physician, and she is today she is dealing with the clinical aspects of AMA. So welcome you, ma'am, to this session. Over to you, and you can unmute yourself. Hello, Dr. Susmita, you can unmute yourself. Hello, doctor. We can continue. You can start.
Hello. Good evening, all. Am I audible?
Yeah, you are audible.
Good evening, all. Am I audible?
Yeah, doctor, you are audible. Can you hear? Hello?
Good evening, all. Am I audible?
Yeah, doctor, you are audible. Can you hear?
ഹലോ, കേൾക്കുന്നില്ലേ? ഇല്ല, കേൾക്കുന്നില്ല. ഓക്കെ. Going to start with the new. We are going to deal with the introduction topic of Kaya. That is a very basic topic. Today we are dealing with the clinical importance of AMA. Myself, Dr. Susmita SG. I have completed my MD in Kaya from Government Ayurvedic College, Trivandrum. And currently I am working as an academic consultant in Switzerland Ayurveda Medical University. So today we can discuss about the clinical importance of AMA. First, we have know the nirukti of ama initially. The word ama is derived from the root word a plus ma. The word a means near or towards, and ma means poison. So the word ama means that the product which is near or towards a poison. Acharya says that Ishatu amyade pachyade iti ama, or amyade pidhyade sodo samuho anena iti ama. It means that ama is the byproduct of incomplete digestion of food materials, and it have the capability of vitiation of different sources. Then we can consider the definition of ama. We can classify uh, the definition of ama in through five basic concepts. The concept one says that it is a very basic concept. It says that so annajo reso idi ama, or anna resasya eva apakasya tanyandare ama vebadesha. It means that ama is known as undigested metabolite in the body. Otherwise, it is known as an improperly formed residadu, which is responsible for the production of diseases. So, uh, uh, it is a definition that is given by Acharya Vijayarakshita. In Ashtanga Hridaya Doshopakramaniya Adhyaya, it also says that Ushmano Alpa Balatvena Dadum Adyam Avajidam Dushtam Amasya Rasam Amam Prajakshade. According to the above verse, ama is produced as a result of reduction in the digestive fire in our body, which lead to improper ahara parinama. And finally, the first dhatu or rasadhatu is first dhatu or rasadhatu is formed from dushta amasya rasa. So the rasadhatu which is formed as dushta in this case. This Aparibhakwa Rasadhatu has the property of vitiation of the succeeding dhatu, and it leads to production of diseases of different kinds. This is a first concept about ama. Then concept two. By considering the case of diseases, Pradhama dosha dushtimcha kejit amam prajakshate. According to this verse is also given by Azari Vijay Rakshita. It says that ama is known as the initial dosha dushti. So, in the production of every diseases, the initial dosha dushti is known as ama. So, then concept three says that concept three is kejittu mala sanjay. It is a given in Madhava Nidana Amavada Prakarana. This means that ama is the accumulation of mala in the body. You all know that we can uh, consider the chronic kidney diseases as an example. It says that uh, the accumulation of serum urea, creatinine, uric acid, etc. in the body will happen in the case of chronic kidney diseases. So that accumulation of serum creatinine, urea, etc. can be taken as an example of AMA in the body. So AMA is known as malasangia in the body. This is a definition in Madhava Nidana. The concept 4 is a little more wide concept, that is Ama Visha. Ama Visha is a concept given by Acharya Vagbada in Matra Siddhi Adhyaya of Sutrasthana. Says that Viruddha Adyashino Ajirna Shilino Vishalakshanam Amadosham Mahagoram Varjayed Visha Samyakam Visharupa Ashukaritvat Viruddha Upakramatvada. It means that ama is the byproduct of ajirna, that is formed as a result of viruddhasana or incompatible food items. So the resultant metabolite is having the property of both visha and ama. So it
Excuse me,
can be
doctor.
treated as mahaghora visha and okay.
Hello. Yeah, you can switch off your camera, doctor, so that we will get a better network. Okay.
Oh,
Okay, you can continue.
is it okay?
Okay.
Then the concept of ama visha, that is the byproduct of it is Amavisha is known as a byproduct of Ajirna, which is formed as a result of Viruddhasana. So it has the symptoms of both Visha and Ama, and it can be treated as Mahaghora Visha, and that should be taken as a category of Varjya Rogas, because Ama and Visha having opposite properties, and Ama should be treated by Agneya measures, and Visha should be treated by Saumya measures. So the treatment of Ama will vitiate Visha, and the treatment of Visha will aggravate Ama. So the Viruddha Upakrama will lead to uh, different kind of diseases, and it should be taken as Varjya. Then that is all about the concept of Amavisha. Then concept of five is also given by Acharya Vagbada. It says that Anya doshebhya eva adyo eva abhyo dushtebhyo anyone murchana kodravebhyo vishasyeva vadanti amasya sambhava. That is, ama, which is originated from highly vitiated dosha itself, by their interaction, which is similar to the development of aflatoxins, which is stored in edible food material called corn meat. That is, it says that ama is originated from highly vitiated doshas by their interaction with each other, similar to drug interactions uh, in modern concept. So, uh, the development of aflatoxin stored up in the edible food material cordon millet can be comparable with the development of ama. These are all about the concepts of ama. Then we can discuss about the relationship between Agni and ama. You all know that the concept of Agni and ama, which is both are having an inversely proportional relationship. So Agni is and ama avastha will lead to Agni. Are all about the relationship between Agni and ama. The proper Agni will lead to Ojas, and improper Agni will lead to ama. Then next we can discuss about the etiological factors of the Ama Nidana can be classified into that is intrinsic factors and extrinsic factors. The intrinsic factors are the Nija Nidanas of Ama, and extrinsic factor are the external factors which are contributing to the development of Ama. Uh, Bija Tushti can be taken as an intrinsic factor in the case of development of Ama. The Madhurja and Pidruja Bhavas. You have studied about Madhurja and Pidruja Bhavas in the case of hereditary disorders. So, the ama, which is transmitted from the bija level itself, lead to the development of diseases through the nija ama. That, for example, Jadaja Prameha, Jadaja Ashes, etc. etc. Then chromosomal disorders. These are inherited to ourselves from the Madhurja and Pitrija Bhavas. So these are the intrinsic factors which are leading to the development of AMA. Then the extrinsic factors are the factors which are developing as a result of our improper lifestyle. This can be classified into various types: Aharaja Nidanas, Viharaja Nidanas, Manasiga Bhava, Desha Kala Ridu Janya Vikaras, then Vaidyaja and Vishaja and Vega Udirana Dharana. These are the external factors which are leading to the development of ama. The Aharaja factors are the factors which are developing through our improper food and food habits, the junk food habit, then the intake of more and more food before the previous food digested, etc. can lead to development in our body. Then viharas, like Vasopna and Avyayama lead to the development of ama. Then we have one doubt that how Manasika Bhavas lead to the development of ama. You all know that the relationship between Rasavaha Shrodas and the Manasika Bhava. Acharya says in the case of Rasadushti, uh, the Rasavaha Shrodo Dushti developed from Upataptena Guptamsha Shoga Krodak Shudadviti. Acharya says one verse. That is Upataptena Bhuktamsha Shoga Krodak Shudadviti means the Manasiga Bhavas like Shoga, Krodha, etc. having the property of vitiation of Rasadhatu. So, improper Ahara Parinama happens and improper Rasadhatu is formed. It can be correlated to the Manasiga Bhava leading to the development of Ama. So, it's clear that Manasiga Bhavas will lead to the development of Ama. Then, Desha Kala Rudu. So, the development of other like development of kind of fever in rainy season and various Pittaja Vigaras will development in Grishma Ritu, etc. can be taken as the Ridujanya, Deshakala Ridujanya Ama production in our body. Deshaja Vigaras, certain kind of diseases like malaria is predominantly seen in Wayanad district of Kerala. It can be then sickle cell anemia also a Deshaja Vigara, like and it is seen in Wayanad district of Kerala. So, uh, the living environment or living atmosphere have also the property of development of ama. Then Vaidyaja Vikaras. Vaidyaja factors which are iatrogenic factors will lead to the development of ama. Uh, Drug interactions, adverse drug reactions, etc., can be correlated as the development of ama, or can be taken as the development of ama. Okay. Then Vishaja factors. Physical factors are the intake of toxins. Initially, it will also uh, develop develop as ama. Then Vega, Udirana and Dharana. It is also Vega Dharana also have the property of development of ama. These are about all about the etiological factors of ama. That is intrinsic and extrinsic factors will lead to the development of ama. And we have classified it into different kinds. And I think you are clear about us. Then next we can discuss about the pathophysiology of ama. The etiological factors, including the extrinsic and intrinsic factors, will lead to agnimandia. This agnimandia will lead to improper digestion and metabolism. That is, impaired digestion and metabolism will lead to ama. That ama will lead to impairment in both absorption and transformation at the systemic level. This improper absorption and transformation will lead to Shrodorota and will lead to Amazanya Vigara Ulpati. These are the common pathophysiology in the case of AMA. We can see the same pathology in different diseases. Example, Jwara. In the case of Jwara, initial Agnimandia and Amavastha will lead to Rasadhatu Dushti, and the Rasadhatu Dushti will again initiate other doshas, and the Sharira Ugma uh, will reach the Sharira Ushma will reach the all over the book, and it will act as Sandaba in our body. So in every diseases you can see the same pathophysiology of farmer. In the initial dosha dushti, in initial dosha dushti, in every disease is correlated with the amavastha, and Agnimandia, impaired digestion and metabolism, and development of pharma, and impaired absorption and transformation in the systemic level lead to Srodurata. This Srodus can be Rasavaha Srodus, Raktavaha Srodus, or Medovaha and Manchavaha Srodus, any kind of Srodus. So, disease will uh, occur in different Sroduses. Uh, where the etiological factors uh, where the etiological factors are more prone to develop diseases. So these are about the pathophysiology in the case of AMA. Then Amajanya Vigara Utpatti can be classified into 4 stages. The stage 1, it is a morbid matter is expelled as Charbi or Adisara. Uh, in the case of Prasavaha Srodhas, the Maha Srodhas is initially vitiated. So the Vikaras will act in Vikaras will occur in the Maha Srodhas. That can be Sardi, Adisara, Grahani, Shuviga, etc. That is the stage 1 in the case of Amajanya Vikaras. It is very easy to cure as the Mahasrotas diseases in the Mahasrotas can be easily treated with the Brahmana, Pajana, and Shodhana measures. So it is very easy to remove the diseases from the Mahasrotas. Stage 1 is a little bit uh, easy to cure. Then stage 2 is known as uh, is somewhat severe while considering the stage 1 disease. Stage 2 disease, the morbid actor undergo PAGA. PAGA will lead to the development of other diseases, example, Jara, Kasa, etc. The second stage is Dosha PAGA Avastha. It is more severe compared to stage 1. Then stage 3 is Sadhugada Avastha. It is more severe and by considering the stage 1 and 2. That is Sadhugada Avastha. Example, it may show the Sai and Sai Lakshanas. By considering the Dhadugada Jwaras, uh, Rasadhadugada, Raktadhadugada, Mamsadhadugada, Medodhadugada, different Am I audible?
Yeah, ma'am, you can continue.
Okay. Stage 3, I will repeat. Stage 3 is Dhadugata Avastha in the case of diseases. It will show the Sthayi and Asthayi Lakshanas. For example, while considering the case of Jwara, you have studied different Dhadugata Lakshanas. Rasa Dhadugata, Rakta Dhadugata, Masa Dhadugata, Medo Dhadugata, Majja Dhadugata, and different kind of different Dhadugata Lakshanas you may have studied. Uh, Similarly, in the case of Kushta also you have studied about different kind of Dhadugata avasthas. These are very difficult to cure from Rasadhatu to Shukradhatu. Then stage 4 is Dhatu Leena Avastha. That is very difficult to cure. That is Bushchikilsya and Dirghakala Anubandha. When in the case of Vishmajwara, the Dhadulina Avastha can be for like in the case of Vishmajwara, you have studied about Dhadulina Avastha. Dhadulina Avastha will lead to Karsh Vivernia and Jardia like symptoms in the case of Vishmajwara. That is Dhadulina Avastha of Ama, that is Dushtigilsya and Dirghakala. These are the 4 stages in the case of uh, Ama. Okay. Then we can discuss about the type of Ama based on the degree of Jadarakni or Dhatvagni. Uh, we can correlate the Ama. We can classify the Ama into Koshtaja and Dhadukada Ama. These two types can cause diseases in two different rogamargas. Uh, like ama can be different divided into ama the one which is developed from ama ama anna will lead to Vigridi and it will lead to the diseases in Mahasrotis. For example, Vishudika, Alasaga, Charti, Adisara, etc. Then Ama Resa will develop Dhadujanya Vigridi, Dhadni Vigridi, and that Dhadugada Ama will lead to the Sarvadehiga Sarvadehi diseases like Amavada, Kushagada, Medoroga, Prameha, etc. These are all about the Jadaragnijanya and Dada Ama development. You can see in the case of then next we can discuss about biophysical properties of it is said by Acharya Vagbada. That is biophysical properties of ama was said by Acharya Vagbada in Doshubhakramanyadhyaya. It says that Avipakvam Asamipam Durgandam Sadanam Sarvagatrana Acharya Madhava has given Bahu Pichila property to Ama. That is, we can discuss it in discuss these points later in detail. Then, general symptoms of Ama, that is Rododa, Balapramsha, Gauru, Anila Murta, Alasya, Apakti Nishtiva, Malasanga, Aradiklama, uh, Lingamalanam Samanam, Niramana Viparya. This is the definition of Ama that is given by Acharya Vagpada in Doshopakramaniya Adhyaya. Shrodoroda means blockage in the body channels. Balapramsha means the loss of strength. Gaura means heaviness of the body. And Anila Mudada known as blockade in the function of Vada. Alasya means laziness. That Apatti means indigestion. Nishtiva means expectoration, which can be uh, considered as expulsion of malas in the cellular level. Malasanga, you know that it is constipation, and aruji, loss of appetite, and klama means weakness. These are the general symptoms of ama. Then next we can consider the effect of ama on dosha, dhatu, and mala. Amena tena samyukta dosha dushasya dushida sama ityupadishyante kecha roga tadutva. Acharya Vagpada says in Doshopakramaniya Adhyaya of Sutrasthana, the dosha is compared with ama. Dosha, when associated with ama, known as sama dosha. Similarly, dusha associated with ama lead to sama dosha, and mala, which is uh, combined with ama, is known as sama mala. We can discuss about the different lakshanas of malas in the body, doshas, dhatu, and mala in the body. Both Sama Lakshana and Nirama Lakshanas are given by Acharya Vagpada in Ashtanga Sangraha Dosha Bheti Adhyaya. It says that in the case of Vada Dosha, Sama Vada Dosha will lead to certain kind of symptoms. Vibando Vayu Samo Vibando Agni Sada Tantra Andhra Kujanam Vedana Shobanistodo Kramasho Angani Pede Vijaret Yugalvachabi Grignadi Kubido Vrisham Snehadir Vridi Mayavi Surya Mekhode Nishti. That is Vibanda, Agni Mandya, different type of Vedanas like Andhra Pujana, Vedana, Shoda, Roda, etc. Can be considered as Vata associated with Ama, and the Vata associated with Ama will aggravate by Snehana, and particularly in cloudy weather and night. You all know that Vada will be Vada getting cured by Snehana and Svedana therapy when it is Kevala Vadika and not associated with other doshas, and when not associated with Ama, Vada getting cured by Snehana and Svedana therapy. If if a painful situation in the body getting aggravated by Snehana and Svedana therapy, then we can consider it as associated with other doshas, or maybe associated with ama. We can consider two. We can consider it the two cases of. Then Nirama Lakshanas of Vada, that is Nirvibandha, Alpa Vedana, Ruksha, and Upashaya with the Sneha. Uh, while treating the Vada Vyadis, we can see that if the doshas are not associated, Vada dosha not associated with other uh, ama, then it shows alpa vedana, then dryness will be seen, and it will be definitely having property of upashya with sneha. So, if for the initial 2 days of treatment, if the pain or the symptoms will reduce in initial 2 days of Snehana therapy, we can consider it as nirama, and we can continue the treatment, continue the snehana therapy. Or if it is aggravated by snehana therapy, then we can consider that the vada is get associated with ama. So amapajana measures should be uh, um, amapajana measures should be done, and should be this is the importance of uh, this is the importance of get importance in while considering sama and nirama avastha uh, in the case of vada vyadis. Okay, then next we can discuss about pitta, which is associated with ama. It shows the symptoms like Durgandham, Haridam, Shyavam, Amlam, Stiram, Guru, Amliga, Hritkanda, Dahakara. These are the Samaja Lakshanas of Pitta. You can see these symptoms in various type of diarrheas, dysentery, etc. Dysentery, then irritable bowel syndrome, inflammatory bowel disease, etc. You can see the Sama Lakshana and Nirama Lakshana. Then Nirama Lakshanas will be that Atamara Pida Varna, no foul smelling. Pitta have the Kadu Rasa by its inherent nature. So that Kadu Rasa, if the patient feels the Kadu Rasa, then it can be considered as Nirama. Then Atyushna and Jadragni, capable of Pajana of the capable of Pajana, then it can be considered as Pitta is not associated with Ama. Then it is also Belya in nature. Then next we can consider the Kabadosha, which is associated with Ama. Avila, Tandula, Sthana, Kandalokna, Durganda, Shuddudkara, Vibandaka. These are the Sama Lakshanas of Kaba. Then uh, the Nirama Lakshanas of Kaba like that Penilam, Pandu, Indidam, Vistaram, Chedagam, and Bhakta Shuddhi. In the case of Sama Avastha, you can see the Shuddh Udkara Dibandha, and in case of Nirama Lakshana, we can see the Bhakta Shuddhi Kaba, the Kaba, which is Nirama, that is Bhakta Shuddhi Krita, that is Nisaraga and Chedaga image. So these are the symptoms of Sama and Nirama Lakshanas of doshas. Then next, Sama Dhadugada Lakshanas are not given by Acharya in Samhitas, but you can see in different stages of diseases, you can see the Sama Lakshanas of Dhadus. So these Sama Dhadus will act as a platform for dosha and dosha samurjana. So the abnormal dhadus, which is both structurally and functionally abnormal dhadus, will create a platform for different kind of diseases. You can see it in Jwara, Kushta, etc. Dhadugada avasthas you can see, and by assessing the patient in detail, you can see the Dhadugada Ama Lakshanas. Okay. Next, we can discuss about the Sama Mala Lakshanas. Purisha and Mutra, both Acharya given Sama Malas like Mutra and Purisha. The Purisha, which is associated with Ama, will be profuse in quantity. It is extremely foul smelling, sticky and formless, and which sinks in water. Then Nirama Lakshana, Purisha will be normal in quantity, which is well formed, normal fecal smell, non-sticky, and float on water. Okay. This is important in case of treatment of Adisara in various diseases like inflammatory bowel diseases, irritable bowel syndrome, etc. you have to classify into Sama and Nirama Avastha and treat accordingly. Okay. Then Sama Mutra, we cloudy, which can be which is having increased specific gravity and specific and density, which is foul smelling. In various diseases like diabetes mellitus, the Rushti, Rushti of Mutra and the association with AMA can be seen. So the urea, uric acid, albumin, sugar, ketone bodies, etc. will be increased in urine. Okay, that is the Sama Lakshanas of Mutra. Then Nirama Lakshanas of Mutra will be like that: clear and transparent urine with normal color and odor. That is Nirama Lakshana of Mutra. This can be understood by urine and the stool examination, and we can uh, compare the various parameters of laboratory investigation with the Mutra and Purisha, Palisha. Okay, and we can classify it as Sama and Nirama. Okay, then assessment tool of AMA. We can assess AMA clinically by laboratory investigations. The first one is symptom-based management, symptom-based assessment. That is Srodha. It can be understood as the blockade to the arteries, veins, lymphatic duct, GI tract, CVS, CNS, etc. Atherosclerosis, hyperlipidemia, etc. can be taken as examples. Okay. The blockade to the arteries, veins, etc. can be compared with the Srodha. So, in a patient, if it shows the blockade in the arteries or veins, then we can definitely known through pulse examination. Okay. Then pulse examination, heart rate examination. Through general examination itself, you can see the Srodha. Then various systemic examinations like the CVS and CNS examination will and GIT examination will lead to the will help in the definite diagnosis of Rodha at various levels. Okay, so we can diagnose accordingly. Then Balabhramsha is known as the loss of Bala or diminished urges or decreased immunity in the body. Uh, you can see the different type of diseases like in the case of corona and in the case of uh, HIV or AIDS, you can definitely see that our body is having a decreased immunity, and it will lead to it, and our body will become susceptible to more and more diseases, which is not common in other healthy individuals. So. Uh, the development of mucormycosis in corona patients can be taken as one example. That is, the decreased immunity will lead to the development of mucormycosis disease in corona patients. Okay, that can be taken as Balabhramsha, example of Balabhramsha. Okay, then Gaurava. The heaviness as if covered by a wet skin can be correlated as a Gaurava. That is Gurbi, then Anila Modana. Anila Modana means loss of normal movement of Vada inside the scrotus, or it can be interpreted as slowness of action. Anila Modana can be seen in the case of Parkinson's disease, where and Huntington's chorea, etc. Here, the normal pathway of our vada is getting hampered, and it will shows abnormal movement. That movement disorders can be taken as an example of Anila Mudra. In the case of Mahasrodhas, the development of flatulence and belching can also be correlated as Anila Mudra. So uh, I think it may be clear. Okay. You can correlate in various systemic levels, that is Anilamudada, while considering the Vyanavada, Anilamudada can be correlated to movement disorders, and while considering the Samhanavada, uh, Anilamudada can be correlated to Anilamudada can be correlated to the development of flatulence, belching, etc. Like this. Then alasya. Alasya means the lack of zeal in spite of having energy, and abhakti means uh, abhakti happens due to the lack of secretory digestive enzymes. Then nishtiva means expectoration, and it can be interpreted as a metabolic based expulsion in the cellular level. Then Malasanga means obstruction of the channels in the body where the waste are excreted. The accumulation of waste product in the body will lead to Malasangya, and it will trigger immune responses in the body. Then Aruzi means